Welcome. I'd like to welcome our international listeners and also remind you that we are on Facebook Live at Resiliency Within if you want to see Bob Doppelt and I in person. I want to start out by just acknowledging that in September of 2023, Puerto Rico, Cuba, and Florida experienced devastation to their communities from hurricanes. Extreme weather events, floods, hurricanes, and disasters like wildfires are linked to a broad range of adverse mental health outcomes. Many types of persistent severe stressors are also rising due to the climate emergencies. And my guest today, Bob Doppelt, who is the founder and coordinator of the International Transformation Resilience Coalition, which we will call the ITRC, because Bob, that's a mouthful.
Yep.
ITRC will discuss why community-based initiatives that use a public health approach to build population-level mental health wellness and transformational resilience are important approaches to combat widespread harmful mental health and psychosocial problems generated by the climate emergencies. I want to say a little bit about Bob. For almost a decade, he directed the Climate Leadership Initiative and taught systems thinking and global warming policy at the University of Oregon. He's an interesting hybrid. He is trained both as a counseling psychologist and environmental science. And I think these two fields came to him in order for him to be the leader that he is about how we can look at the mental health challenges that happen as a result of climate emergencies. And in 2015, he was named one of the Bob, this is pretty impressive. One of the 50 most talented social innovators by the World CRS Congress. His latest book, Preventing and Healing Climate Traumas, a guide for building resilience and hope in communities, will be available hopefully March or April of 2023. We actually have the same publisher and we're working at the same deadline. So we'll see what happens, but we're hoping in the spring that his book will be published. So today he will share why the ITRC supports the Community Mental Wellness and Resiliency Act. I'm going to say it again, the Community Mental Wellness and Resiliency Act that was introduced to Congress just last week by a bipartisan effort of Representative Paul Tonko and Representative Brian Fitzpatrick. I want to say this was a bipartisan effort, which is very exciting to know about. And so Bob's going to share with us the important elements of this act. But before we do that, Bob, I'm going to ask you my question I always ask my guests to begin with. Anything particularly on your mind today before we get into some of our planned questions?
Well, first, Elaine, thank you for having me on the show, and thank you for all the work you do and TRI, Trauma Resource Institute, has done over the years. For all of you listening, Elaine has been a core member of the ITRC since the inception,
Yes.
and one of the very first people and organizations to join, and has really done tremendous work, as you all know, probably your listeners know. So I just want to thank you for that. And I guess what's on my mind today is just how do we move forward in reducing the mental health and psychosocial impacts we see from the tremendous amount of stresses, persistent, overwhelming stresses that people all over the world are experiencing, that climate change is adding to and aggravating because we're seeing problems everywhere. And we know what we can do about them. How do we move forward in implementing these approaches that we know can work?
Well, so let me ask you this question as we're getting started. So, in the US and other nations, like I'm thinking about Pakistan, that has had terrible floods over the last few months. Um, so, many places are experiencing a significant rise in mental health and psychosocial problems. And, why is this happening? What is your opinion with your, again, your hybrid environmental sciences and psychology? Why do you think this is happening right now at this time?
Well, it's a very good question. I don't know that much about what's happening in Pakistan. I can speak about Western nations, but other nations also. But I think what's really important to understand is the medical model of health has focused us on, in our profession, and I was trained in this, in the sort of genetic and interpersonal family issues, child-parent issues, as the dominant cause of mental health and psychosocial problems. But what we now know, what is very clear, especially if you look back in time and look at what's happening now, is that actually these problems result from the integration of and the complex interactions between personal, genetic factors, family dynamics, but also social norms and policies, the communities that people live in, the economic situations they experience, the political situations they experience, and the ecological factors. Every country, every community differs in its culture, its norms and practices based on the kind of ecology that it lives in. It's different in areas that are very dry versus temperate rainforests, et cetera. But so all of those factors today are interacting. You could say it's there was an old statement by James Carville about politics. It's the economy, stupid. Remember years ago in the
Yeah,
US? It's
I
the
remember that.
environment, stupid. That is to say that all of the environment around us is what produces those mental health and psychosocial problems. But if we only focus on the individual then and don't address these other factors, we're going to have limited effect. And I think that's what's happening. The climate emergency is aggravating all of those other personal, social, cultural, economic, built, physical, the infrastructure and communities, et cetera, and economic and ecological factors. But all of those are very stressed today, stressful today, and are being stressed out, those factors. And we have to really think systemically, think about all those issues and factors at once and respond holistically, if you will, respond to all of them in some way, not just to the individual one.
So we have to have a multifaceted approach is what I'm hearing from you. And I know I've worked, very hard for this idea as well, because if we only look at it as an individual person impacted by, let's say, a hurricane, of course, they may have lost their home, their job, and that is a horrible thing. We want to help them. But if we don't look at the social policies that go along, let's say to even providing assistance, I was talking to a person recently that really had severe damage to her home during Hurricane Florence. And she was sharing with me how she had to get a loan out. She thought that there was going to be more help from organizations like FEMA that does do it, that is helpful. But at the same time, she had mold in her house and FEMA didn't cover mold from the water, of course, that comes in. And so you go, well, goodness gracious, why wouldn't you have a policy that would cover mold that would help that person reconstruct their life? But I mean, I think that's kind of the limited kind of blinder thinking if we think, oh, this is all that we cover, when it really does impact so many aspects of a person's not only personal life, their community life, and really their societal life in that respect. So I couldn't agree more with you. And I guess that leads me to my next question, which are climate change generated mental health problems mostly caused by acute disasters, or are persistent, overwhelming, or toxic stresses also a key cause?
Yeah, thank you for that question, Elaine. That's very important. The disasters capture our attention, obviously, the most, that we get the most news about it, et cetera, and they're the most distressing events because they're obvious. They are very important. Up to 40% of the people who are directly impacted by a disaster can experience a mental health or psychosocial problem, and even people who observe the event from afar or know someone who is impacted can experience severe distress or traumas. But actually, even more, just as importantly, or even more importantly, are these toxic stresses, as we call it in the mental health field, these severe, persistent stresses that just make it very difficult to keep up with. And the thing is, that affects everyone. So just those stresses affect everyone. So just as an example, I live in the Pacific Northwest of the US. We have had wildfires raging most of the summer and in all the previous summers because of this long-term drought, which is likely to continue for the rest of the decade, by the way. And so the wildfires affect people living, that's a disaster affecting people living close by. But smoke from the wildfire has gone out and affected the mental health and physical health of people throughout the entire Pacific Northwest, all the way up into Canada and down into California. So it impacts everyone. So the disasters are interconnected with and mixed in with these population-wide toxic stresses. And then in a different year, different parts of the population will experience one of these disasters. So that's the mixture we have, and we have to focus on both. And you cannot just do disaster mental health, meaning respond to the disaster. We have to prepare everybody for what is already happening and coming our way by addressing what you call these multi-systemic approaches. That's what's critical. We
Well,
need multi-systemic
well,
approaches.
and as you're talking about that, I was just talking to one of my daughters, the mom's on her daughter's soccer team. And she was saying how her son has had the most terrible asthma. And, she had to go to the like emergency room twice. So why does asthma happen? Of course, there's many things that cause asthma, but we know that when we have fires and we have the smoke that comes from fires, and we've had fires in California. I know you've had a horrible time in Oregon. So what happens with the environment when someone has a condition like asthma? Does that increase their chances of having problems breathing and an asthma attack? Well, of course it does. And so then you have going to the emergency room, you have the anxiety of the child and the parents, you have the system of healthcare, which we were also talking about, because there were like no rooms at the inn. So urgent care, can be closed. And so then you have to go to the emergency room. I mean, I think that's just one system that I'm talking about regarding one condition that impacts someone in a multitude of ways, not only an individual, but a family, but also a societal policy of healthcare. So anyway, I just wanted to bring that into the conversation, because sometimes we don't look at it like that. Right? We just look at as immediate disaster response. We see the images from Hurricane Florence. We see that there's first responders, but you and I both know that is just the beginning of what is to come. So anyway, I don't know if you want to make a comment on that or not.
Well, yeah, I mean, this is the bad news. This is difficult to understand and to get our heads around, but we are in the midst of a civilization altering event. Global temperatures are going to rise beyond the 2.7 degrees Fahrenheit, 1.5 degrees Celsius temperature threshold that climate scientists are very sure will unleash very severe and possibly even irreversible impacts. The question is, can we implement solutions to the climate emergency now, which go well beyond just shifting out our energy systems? That's vital, but and bring temperatures back down again to manageable levels after it overshoots. That's what climate scientists call this overshooting, climate overshoot, this threshold. So we have to prepare for it. What we're seeing now is just the beginning of very, very serious impacts that will impact everybody. It's a population level problem.
Well, so let me say this. Do you think that you and I both agree that individualized mental health treatments, although very needed, are not enough to deal with what we're talking about?
Absolutely. They are very important. The individual clinical treatment and direct service programs, social service programs are very, very important. They'll remain important. But even today, they can only help maybe at best a quarter of the people that, at least in the US, that need mental health or that kind of assistance. And as the climate emergency worsens, they'll be able to assist even fewer. So we have to take a different approach.
Right. And so I would just want to just kind of emphasize with our listeners is that there are not enough mental health providers to meet the need that will happen from these emergencies.
Exactly.
So we have to think outside the box about if that's the case. Of course, we still need that. And if you are lucky enough to have the accessibility, the affordability, and the believability that that's something that can help you, then that's going to be an avenue that you might be able to take. But we know that there are enormous amounts of people that are not going to be able to do that. So let's talk a little bit about why are community-based initiatives that use a public health approach to mental wellness and resilience needed, and how does that differ?
Great. Good question. Thank you. Well, first of all, again, clinical treatment, direct service, human service programs will remain very important, but they will become much more effective if they're become part of and are integrated in community-based initiatives. And what I mean by that, and what is meant by that in the field, is that this involves engaging local grassroots leaders, neighborhood leaders, public, private, and nonprofit organization leaders in coalitions. We call them resilience coordinating coalitions, but each group calls it whatever they want. And by the way, this is already happening. We didn't make this up. We're just now trying to scale it up and apply it directly to the climate emergency. These initiatives help everyone in the community, both children, adults, working age adults, and older adults, develop their capacity, strengthen their capacity for mental wellness and resilience for all types of adversities. And there's a couple of, we can get into the specifics of what those community-based initiatives need to focus on, but the difference between this and is a public health approach, between a public health approach and clinical treatment, is the primary focus is prevention first. Healing methods are integrated into the prevention approaches. And it focuses on the entire population, not just quote unquote the most vulnerable or those that are showing signs of symptoms of pathology. And it really tries to strengthen protective factors that exist already and form new ones rather than fixing deficit and problems in the community. So that's a public health approach, very different. I mean, there's more to it than that, but that's very different than an individualized clinical treatment approach.
Because that means everyone can really benefit from this. And I want to say something, and this is my opinion, Bob. I just want to, is that there's there's controversy over amongst some people. There's some people that don't believe that we are in a climate change emergency. But regardless of whether you believe that or not, most people that I've spoken with don't want people to suffer. And that if you may not believe that's true, but there's still hurricanes, floods, fires that are happening. And how can we come together as common people, right? No matter what we believe about why it's happening, to think about community-based approaches that are for the benefit of all people. I don't know, what you think about that, but I know that does exist. And I think that doesn't change the fact that we need to come together and think about this act, like the Community Mental Wellness and Resilience Act that we're going to talk about now, and why that's important. So I don't know if you have a comment to make about what I just said.
Yeah, I think that's such an important point, Elaine, that when you really think about what these community-based initiatives do, they really sort of return the responsibility and the chance of building wellness and resilience and help people flourish to communities, to neighborhoods and communities where it existed for most of human history and has the greatest chance for success, rather than just making it the responsibility of professionals, trained, licensed professionals to help people with these issues. It's our job. And in fact, we all will benefit when we do that. We will all have a chance to thrive. And also, by taking that approach, what we find is much better success in addressing climate problems, because people are now working together. It's not, we're going to rely on this company or this specialist over there to figure out what we're going to do about it. We're all engaged because we all have a role in it. When people who are directly affected by any change, when they are actively involved in the change process, you're going to get much greater chances of very constructive, positive outcomes.
Well, I just want to say, when you first told me about Representatives Paul Tonko and Brian Fitzpatrick, I was very encouraged, because I think we'd have to almost be, not living in America, not to know that there's so much divisiveness happening right now. And to think we have a Democrat and a Republican coming together in co-sponsorship to say, this is really an important act and we're co-sponsoring this. Can you tell us a little bit about how on earth did that happen?
Well, yes, that's a very good point. And yes, Brian Fitzpatrick is a Republican from Pennsylvania, and he's the co-sponsor with Representative Paul Tonko, who's a Democrat from New York. And I think Representative Tonko and his staff deserve the credit for reaching out to Representative Fitzpatrick and explaining this all to them. I think they have a relationship anyway. So I think that they deserve that credit. And Representative Kirkpatrick deserves the credit for understanding what's happening because he's undoubtedly seeing the mental health impacts going on, irregardless of climate change, in his district, and knows we need to expand the way we approach these issues. So I think many Republicans understand this. Politically, they're in a tight position for whatever reasons, and they don't feel like they can talk about it because they'll get criticized from certain, especially interest groups that have money, and et cetera. But I think we will grow out of this only because it's so obvious about what's happening. It's very hard when your district is impacted consistently by some type of adversity to just deny that it's happening. They might not use the term climate change. Who cares? But I think we're going to make progress here.
Well, I just have to say, I have many members of my family that are Republican, and they really care about the mental well-being of their communities. And so I think that they are very happy to hear about this act and about coming together rather than not being divisive about this. So I just want to do a shout out to both of those representatives for coming together to bring this forward. So I'm hoping what we can do, we'll start a little bit before our break and talking about what is the Community Mental Wellness and Resilience Act, and really kind of find out what the purpose is and a little bit of the nuts and bolts so that our listeners can understand. Because what I understand is one of the things we would encourage people to do if they think this is a worthwhile idea to bring to your community, we're hoping that people are going to call up their legislators and say, hey, this is a very important act for you to take a look at, and would you consider co-sponsoring it? So I know that's one of the things that is our joint kind of idea mission. I don't know, the ITRCs, that could we get a groundswell of support for this so that we could have these resiliency ideas that will be all over the country. So do you want to say a little bit, just to start, is what is the purpose?
The purpose is to that the federal government and CDC, the Center for Disease Control and Prevention, specifically would support and fund community-based initiatives that organize broad and diverse coalitions and use a public health approach to build population-level capacity. That is, help everyone build their capacity for wellness and resilience in the midst of all types of adversities. Doing that is going to prevent a tremendous number of mental health and psychosocial problems and help heal them when they do occur. So that's what the act is about. There's more specifics about it, but it's really trying to mobilize and inspire and engage communities through diverse partnerships to reach out to all adults and all youth and help them develop the skills and develop the resources, strengths, and other protective factors that can help them prevent and heal mental health and psychosocial problems.
Well, that sounds like an easy thing to do.
No
Not,
problem.
no problem. So, so let me ask you this. And here I am, I'm a person, I live in a community, I live in Southern California, which we have had, fires, floods, we've had, earthquakes, we get a lot of stuff out here. So how could, like me as one person who lives within a community, how would I be able to get involved with the Community Mental Wellness and Resilience Act? Would one person be able to get involved with it or not?
Yes, good question. First of all, backing up, there are many initiatives like this underway around the country. So we can learn from how they got organized, what the kind of work they do, et cetera. The state of North Carolina has many different coalitions being organized at either the community, some are at the county level, which just makes sense at a rural area. And there's many others, and we can talk about some of them in a second. But what an individual can do is search around your community and see if there is an initiative like this underway, and see if you can join one and help. Or if not, start talking to 2 or 3 other friends, colleagues, et cetera. Talk about what a resilience coordinating coalition could do. What do you see happening in your community already with mental health issues? Are things siloed and fragmented? Are different organizations working in different places, but nothing's coordinated? And then build a common vision from there about what you would like to see this coalition do and start talking to others and build it outward. That's how they
So,
all start.
so Bob, do you think that a lot of the people who are working with these ideas are siloed? So they're not necessarily talking to one another, but they're kind of doing their little piece in this part of the county or in that part of the county, but they're not necessarily in this kind of organizing movement that I think this Community Mental Wellness and Resilience Act is really espousing. And that's one of the key components of the act, bringing people
That's right.
together.
That's one of the fragmentation and the siloing is very significant in almost every community. And most of the work that is going on is a reactive response to a problem, addiction, adverse childhood experiences, community violence. The Community Mental Wellness and Resilience Act flips that around and makes it proactive, focused on building prevention to prevent those problems from happening. And that means helping everyone develop those resilient skills, make social connections across boundaries, which we can talk about, which is really the most important part. You mentioned it earlier as you talked. So there's a number of elements involved with proactive, systematic prevention versus the reactive treatment approach, which tends to dominate most community programs, and even they are often siloed. So those programs will be more effective, as I said, if they come into and become integrated with the community-based, prevention-focused, that is public health-focused mental wellness and resilience initiatives.
Well, so I want to continue this conversation. We're going to take a break in just a minute. And I want to really kind of tease this apart and talk about more elements of the act and also things like, why do we think it's, you're giving us some ideas of why we think it's needed. But I'm thinking as you were talking, just even about the opioid crisis. I mean, this kind of prevention is not only about the climate emergencies, but it's about these other environmental emergencies. When I look at the degree of opioid um, overdoses that are happening in the country. And do you think that this also could help perhaps build in infrastructure for that terrible problem that we're facing right now?
I think it can. There are people who are already experiencing that kind of disorder will continue to need direct service or clinical treatment programs. That is going to continue to be vital. But the more they're integrated into the community-based initiatives, the more chances they have to build relationships with other people that they don't know, that are healthier or more resilient, that might help them with these. And they can also engage in group and community-minded healing opportunities, which is different than individualized clinical treatment.
Well, and I'm also thinking about prevention.
Right.
That if you are involved with a community that is socially engaged, you may never ever get addicted to something.
That's exactly right.
And so so I think that I hope our listeners are hearing the implications of this act could be incredible and immense, that could affect many sectors of our society and many of the issues that people are struggling with. So we are going to be back in just a couple minutes, and we are going to continue this really exciting conversation with Bob Doppelt to tease apart a little bit more of the elements of the Community Mental Wellness and Resilience Act. So this is Elaine Miller-Karras, and we will be back shortly after this break. So this is Elaine Miller-Karras, and I'm here with Bob Doppelt, who's talking about the International Transformation and Resilience Coalition, the ITRC, and a new piece of legislation that was just introduced last week. And I'm going to call it the CMWRA because it is also a very long name. But why don't you say what the CMWRA stands for, Bob? Let's hear it again.
Community Mental Wellness and Resilience Act.
Okay, I love that. So when we think about this act, we've already been talking about it before the break about what problems that could be structured to address, but I think there's more. And so I'm wondering if you could give us a little bit more information. I'm thinking about, I'm a community member and I love this act and I want to go and start talking it up to people that I know, and maybe even I'll call up my legislator and say, hey, have you heard about this? And I want to talk to you about it. What would be some of the key talking points of what I would want to say to my legislator who might say, hey, okay, I want to know more about that?
Great. Well, thank you for that question. Yes, I just, as for a purely political statement here, if any of your reader or listeners can contact their legislators and ask them to contact Representative Paul Tonko or Brian Fitzpatrick and co-sponsor, agree to co-sponsor the Community Mental Wellness and Resilience Act. That would be fabulous. They should be able to find it now, that the act, on the congressional website. They have their own internal website. They can find that. And there is already a growing number of co-sponsors, but we need to get a large number to then get a hearing and move this act forward. So that's just the process. But I think what's important is to think about the key elements involved with building community resilience within the community for the entire population. One is to build strong social support networks across geographic, racial, and cultural boundaries in the community. That's a critical aspect, probably the most important about building resilience. And it counters and will address the toxic social isolation so many people are experiencing today that really does contribute significantly to the mental health problems we're seeing all over Western nations and increasingly in other countries too. The internet contributes to that, despite all its benefits. And the pandemic really aggravated that even more with the social isolation. But this has been growing for a long time. And so there are many ways that community-based initiatives can bring people together, help people meet each other and connect with each other. I can give you a few examples of communities that are doing that in a second, but that's just one kind of benefit you can talk about. We can build social connections and supports in our community if we enact this policy, get funding in our community to organize and operate these community-based initiatives.
Well, Bob, could you give us an example of some communities that have are already doing this and are working towards building resilient communities?
Sure, and there's many examples, but just in terms of building social connections across boundaries, for example, two that stand out. There's many doing it, but one is Abundant Community Edmonton, up there in Edmonton, Canada. And you can get on the web and Google it. And what they do, they realized that those social connections were vital. So they actually went out and recruit block connectors, people living on each block, who they train in how to go around, knock on the door of every other person living on the block, every other house and apartment, and they interview them and find out who they are, what their passions are, what they like to do, what their concerns are. They put that all into a database and share it with everybody. So people who like to go woodworking didn't know that the person down the street also likes to do woodworking, and they meet each other and they can start to do woodworking together. And people who go out early in the morning for long walks now realize that there's others somewhere close to them that like to do morning walks also for exercise with their dogs, and they meet those people and go out and do that. That is really building the social connections within Edmonton. And this has grown, and it's really a very powerful and they've done research shows the effectiveness of that. The San Francisco Neighborhood Empowerment Program in San Francisco takes a different approach, but does the same thing. They hold block parties. They close off the street, and they train people, give them information about how to organize a block party to get everybody together for potlucks, etc. And you get to meet your neighbors. And from that, they get a group together that develops a resilience strategy for the community, for the neighborhood, when there might be any kind of adversity. Could be an earthquake, could be a climate-related adversity, could be violence in the community. And they have a strategy that's also linked with organizing resilience hubs in the neighborhood, a place where people can go to provide food, shelter, water, or connect with others in the midst of adversities. Those are just two examples of, and there's many others, of very exciting programs that are just working on the social support side of it. And there's
Well,
other
and I
elements.
think I remember, I don't know if this is a San Francisco group, but at one of the conferences that we did before the pandemic, there was a gentleman that was talking about in San Francisco, that San Francisco has been used to a pretty cool climate, and there are lots of elders that live in houses or apartments. And when they had a heat wave, there was no air conditioning. So there was because of these kinds of coalitions, they were able to somehow get air conditioning units, portable ones, take them to the units where the elders were living. Because believe it or not, in America, people die from being overheated when they're old and when they're in kind of climate change that can happen when all of a sudden it's 100 degrees out when it's used to being 70 or 60 degrees. So is that, did that come out of that San Francisco group, Bob? That's what I'm
Yeah, I think that
reminding of
is the
that.
San Francisco Neighborhood Empowerment Program, the NEN as they call it. They do that kind of work, but those social connections, once you get to know and meet other people, you develop what's called weak and strong social connections. The strong ones are your close family, friends, and neighbors. You start to give, but then the weak ones are people, the seniors that live down the block that don't have air conditioning or whatever it might be. And people start to help each other. They know, oh, wait a second, so-and-so's in that apartment's not mobile. It's a really bad time now. Let's go see if they need help getting somewhere to a resilience hub or something like that. So you build those connections that are vital in disasters, and they're also vital just in normal times. They help connect people and avoid that toxic isolation, social isolation that's really a mental health problem.
Well, when I saw what was happening in Florida, it was clear to me that many of the people that died in Florida were over the age of 60.
Right.
And were there reasons why they could not leave their housing because they didn't have transportation? They weren't able to do that. And we do see that in many parts of the world, that the people that are um, who have the lack of mobility, it's hard for them to respond to disasters.
Absolutely.
And so those kind of initiatives then become so important, that you have able-bodied people helping those that may need extra help.
Right. And then when you help others, you also know that if you needed help, someone would help you too. And it becomes a community building. It's a collective efficacy is the buzzword that we use in our field, but the social efficacy, that community comes together to help everyone. And what we often see when that happens, when you take the time to build those connections slowly, it takes a little time, but is that people who initially didn't like each other or thought they didn't like each other because they looked or acted or thought differently or so, suddenly develop relationships. You overcome this polarization. You might not agree with them politically down the road, but you start to help each other and work each other. We just see it everywhere where these kind of initiatives are going on, and that can be extremely powerful, not just for the climate emergency, but for all the other tensions and struggles that we're experiencing around the world.
Well, so I know that you have 5 core foundational areas in the ITRC research that have been identified regarding community initiatives that we need to focus on to build population level capacity for mental wellness and transformational resilience. I think you're probably just naming one of them, but could you expand upon that, because I think it's so important for us to know the ingredients.
Right. Well, thank you for that question. Yeah, so we kicked off 2 years ago, we kicked off an extensive research. We looked all around the world. I interviewed, and we had grad students interviewing people everywhere, saying, has anybody got a strategies and approaches that are effective for helping communities and individuals with ongoing, persistent traumas, adversities of many different kinds. And what resulted from that was the identification of these 5 core foundational areas that community-based initiatives can focus on. The first and most important is just what I was talking about. Build social connections, supports across geographic, economic, cultural, racial boundaries. The second is what we call focus on a just transition by building healthy, safe, and resilient economic conditions, physical built conditions, meaning housing, transportation systems, parks, etc., and ecological conditions. All of those factors, when they're in bad condition, they really affect mental health problems. And when you engage residents in improving those, we find great evidence that increases the capacity for mental wellness and resilience. The third is what we call like increasing or developing population level mental wellness literacy. That is, that builds on health literacy, helping everyone understand how trauma and toxic stress can affect their mind and body and emotions, and how trauma and toxic stress affect groups. It causes groups to just get all riled up and attack others, et cetera, because of the fear and alarm center of our brain being activated. And there's many groups that teach people about this in age and culturally appropriate ways. So people go, oh, I know what's happening within me now. And then you teach them skills like the Trauma Resource Institute does all over the world to first calm their body, minds, and emotions. We call them presencing skills to become more present. And then once people have that, which is trying to create some space between what's happening to you and your reaction to it, to give you a little space to decide what the best way is to respond. Then also focusing on what we call purposing skills, which really is how do you want to live your life now in the midst of adversity? What's your purpose? And they're in psychology, it's adversity-based growth skills. So that's the third. The fourth is what we found is many communities focus and try to engage community members in a set of activities that is really clear, the evidence shows, helps support mental wellness and resilience. So one is laughing a lot, finding ways in the midst of ongoing adversities to laugh at things. And there are actually some community resilience organizations and programs that have developed laughing programs, programs to help people find humor in things. There's also finding compassion for others and forgiveness, helping everyone learn forgiveness skills for themselves, because when we're stressed, we often do things that impact other people in an adverse way. So we have to forgive ourselves. We have to forgive others when they impact us. But that doesn't mean let people off the hook. It just means forgiveness is about helping ourselves deal with issues. And there's some other practical experience of that. And the last one is what I was mentioning before. The fifth is really to integrate, and communities need to establish a wide range of age and culturally appropriate methods for people to heal the traumas they do experience. When residents engage in those other four activities that I talked about, many prevent mental health problems or are able to heal them when they do emerge. But there still, as the climate emergency worsens, going to be many people who are traumatized. And I'm not talking about clinical treatment. That will be one part of it. But the more important area is community-based and group-minded initiatives, healing circles, peer-to-peer approaches like the Trauma Resource Institute does often, and training people in different resilience skills. There's art therapy, nature-based therapy, and many other approaches. And you really have to sort of say what resonates with residents in our community or in this neighborhood, and establish those programs on an ongoing basis, not just after a disaster takes place or some sort of community event takes place. So those are the five, and there's programs like this all over the world. Communities can learn from them, integrate that, and really become a powerful factor in their community.
Well, and Bob, as you're talking, it's very hopeful what you're talking about. And I've spoken to many people that are very worried about our planet. And sometimes that worry can take us into dark and depressed places. And I had someone say to me not too long ago saying, I don't know, I'm so depressed that sometimes I don't even know if I should keep living if this is what's happening around us. And of course, my role in that particular conversation was to make sure she was okay. But I think that when I can start to talk to people about what else is true, yes, we have this emergency happening with all these climate emergencies, but we have people like you, like members of the ITRC, working to create these population-based ideas and really trying to implement them. It really is the hope of human beings, right? That we have a way and a strategy and ways that we can come together that are actually already being done. And some of it may just be replicating what other people are doing. And I was thinking as you were talking, I want to know what questions those people in Edmonton are using to ask their neighborhood. I'm going, well, I imagine some people don't want to share, but I mean, just the idea of, do you have a template Is there going to be is there a place that we can go to and say, oh, this is what they're doing in Edmonton? And I know that you're in the process of creating a new website. And can you talk to us a little bit about on the new website? Is there going to be opportunities for us to look at some of those communities like Edmonton that are creating these kinds of opportunities for their citizens?
Yeah, by the way, just get on the Edmonton, Abundant Community Edmonton website and you'll find their manual with the
All
questions.
right. All
So there
right.
you go.
Great. I'm so glad to hear that.
And Howard Lawrence and his staff really do a great job up there. There's ample resources. Yeah, we've been delayed in creating our new website, but there'll be many, many resources up there. We're running a community of practice right now on
Okay,
these skills.
what is that? Let's tell them what that is, because even though that's already happening, there's going to be more in the future. So
Right.
tell us exactly what that is.
It's when people come together and there's people involved with this community practice from the U.S., Canada, all sorts of places in the EU, to learn about the principles and practices of a public health approach to mental wellness and resilience, hear from practitioners in the field doing different parts of this, and then go out and apply it in their own community, come back, say, I'm having this problem with this, or how can you help me with this, and really trying to grow this activity, these activities and this movement. And at the same time, as you mentioned, I do have a book coming out. When we were interviewing people and finding all these interesting programs, people said, well, is there a manual for how to do this? And that's what led me to write the book. It wasn't initially the idea. So it's a how-to guide. I thought, as you did about your book, it was going to be done and ready in January, but it's not. Now it's March, as we've just been told. But it's out there. But there's a number of different documents on the ITRC website, and it'll get better if we get a chance to finish it in a month, to provide more information. So, and if anybody has questions about these kind of things, tell me about this kind of program or whatever, email us at trig-cli.org, trig-cli.org, and one of our staff can send information to you about it.
And also, and the website, tell them the name of the website, because I think they can get to your email through the website that you
Well,
have
just Google
now.
the International Transformational Resilience Coalition, and it'll come up. It's actually the Resource Innovation Group website, which is the nonprofit that sponsors the ITRC. But that's when the new website will just be ITRC. And you're right, it's a mouthful, but it took about, I don't know, you were part of it.
I know it was.
200 emails back and forth between folks trying to decide on the name of the organization. But what we mean by transformational resilience, and let me just follow this up really quickly,
All right.
is that it's not about bouncing back to where you were before a disaster or adversity hit you. We know that there are ways and skills and procedures that can help people use adversities and crisis as powerful catalysts to increase well-being, to increase collective and individual well-being. That's why we call it transformational resilience. How do we use the climate crisis actually as a powerful catalyst to help us all end up better off in the long run while we deal with these adversities that the climate crisis is going to generate and is already generating? And we know we can do it. We have proof, we have seen it around the world that this can improve our well-being. The question is, how do we develop that movement to really focus on that?
Well, and I just want to say that what I've seen is that the way that we're approaching this through the ITRC is that it is empowering. It is not forgetting the suffering, but it's also
Absolutely.
remembering what I often say on this show, and my regular listeners will have heard this before: what else is true, and what can we pull together, which actually is very hopeful. So I cannot believe this has gone again. Sometimes my time just slips through my fingertips. We only have a few minutes left, and Bob, I'm just wondering what would you like to say as kind of like a parting statement of what you would like our listeners to think about, to know about the ITRC, and also about this very important act.
Well, good question. I think that the bottom line for me is for each of your listeners to look around their neighborhood and their community and see how they can join with some others. Who else can you join with to give a dialogue going about how to develop a coalition, a network in your community that begins to help everyone increase their capacity for resilience for ongoing adversities. Look for organizations that already exist, talk to them. There might not be one, or they might just be in the reactive treatment mode, and really try to grow this movement all over. And part of that is going to require funding. That's partly what the Community Mental Wellness and Resilience Act will do. But you can also go out to local funders, donors, members in your community and seek funding, or to your city or to their state and ask them to do that. I know that and where I live in Oregon, we're talking with some state representatives about enacting a similar policy to the Community Mental Wellness and Resilience Act at the federal level at the state level. Go talk to your legislators there. And get that same kind of programs going there. So get these kind of initiatives underway, learn about it, get them underway, and at the same time, push for changes at the policy level. And the more that people get involved with activism, both in the mental wellness and resilience field, but also just to reduce greenhouse gas emissions and restore ecological systems, because they're vital to the climate emergency. The more people get engaged with both of those and link those together in communities, right now they're siloed. People doing resiliency work and people doing greenhouse gas emissions, link those together, we will create a powerful force.
Okay. Thank you so much, Bob, for your time today. And I also want to do a shout out as we're ending to Representatives Paul Tonko and Brian Fitzpatrick for the work they're doing in a bipartisan way to bring this very important Community Mental Wellness and Resiliency Act forward. And also, I also want to do a shout out to Bob's book. It's called Preventing and Healing Climate Traumas, a Guide to Building Resilience and Hope in Communities. And again, it's going to be available in March 2023. But he has another book called The Transformation Resilience, How Building Human Resilience for Climate Disruption Can Safeguard Society and Increase Well-Being. And that's already published, and it's a good read. So Bob, again, thank you. And listeners, remember what else is true. We can come together as a common humanity, as people working together to solve these very difficult problems that our world is facing right now. And for all of you who are suffering, all the folks in Florida, Kentucky, Pakistan, Puerto Rico, all the fires that have been happening all over the country, there's too many to name. Just know that we are thinking about you. We're thinking about proactive ways to help our citizens of the world. So again, remember what else is true, and also your own individual life and who uplifts you, who brings you calm, that can help in that calming, that very often then can provide ideas for solutions to our life's problems, our families and societies. So Bob, thank you so much.
Thank you, and thank all of you. Good luck to everybody.
Thank you. Signing off, Elaine Miller-Karras for Resiliency Within.